So we have a child with an unfamiliar caregiver in an unfamiliar setting who already has a lot of sensory irregularities, being given a test that wasn't standardized in children with special needs that stresses the child further, and we often see the child's worst level of functioning. And then the parent is given that feedback, and the parent says, but at home, he can do much better, blah, 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 blah. And the clinician says, come on, stop denying the problem. You're in denial, etc. And what happens is you get a negative cycle with a discouraged parents, a misdiagnosis often because the child is seen under stress. Cute little story. A mom who was recently evaluated at the one of the premier medical centers on the East Coast. I won't say which one, not to embarrass those of you who might be here from that medical center. But the child was diagnosed with a severe form of autism because of all the things that I just mentioned. And the mommy is crying, walking to her car, and was given a negative prognosis that the child would never be able to do very much. And while walking to the car, mommy is crying, and the child, who's a 4.5-year-old child, says to mommy, "Mommy, what's the matter? Did they make you upset? What did they say to hurt your feelings?" The difference between this model and most other developmental models is by focusing in on these functional emotional developmental capacities, we're looking for the capacities that orchestrate the entire mental team, that get all the players working together, vision and hearing and movement and so forth. And also the other core concept is these emotions that we're talking about, these emotional levels, transform the emotions as you go from one level to the next. So when a baby learns to be a co-regulated affect signaler, a continuous flow of back and forth signaling at level 4, what we call shared social problem solving, that child's emotional life is different from what it was at 8 months or at 4 months. The emotional life becomes transformed. It's not as though the child has urges that have to then be suppressed by cognitive capacities which say, I want to bite, don't bite. Of course that happens to some degree in all of us. We all get angry, we say we shouldn't do that. But in healthy development, the basic emotional capacities get transformed so that when you reach, for example, a higher level of empathy and compassion, you don't have the same violent urges that you do when you don't have that level. So even though you still may have conflict between should I insult this person or not, your conflict is not should I kill the person or not, it's just should I insult the person or not. And so your emotions transform. And in this model, the emotions become the leader of the team and become the way in which we engage and learn about the world. Of the 20 children we talked about before who did very well, we were able to follow up with 16 of those 20, 10 to 15 years later, after they had begun their intervention. So this is way after they had completed the formal intervention program, and the children now are in various stages of adolescence. Some were going off to college, some had begun college, and we were interested to see, one, would the gains that they were showing in school continue even without continuing intervention? Two, would they continue to advance? Would these children get to be even higher levels of empathy and reflective thinking? And what would they be like? The major findings were that for at least a subgroup of children, we don't know how many or how large it is, that the core deficits are reversible. The core deficits having to do with reciprocal emotional signaling, creative use of ideas, and inferential thinking, abstract reflective thinking, that all these children, all 16 of them were capable of that, as were the 20 I presented earlier, as were the 58% that that was our criteria for good to outcome interventions. And that once past certain levels of competence, the gains seem to hold up long after the intervention, the formal intervention is stopped. And what we kept hearing over and over was how sweet and empathetic and warm and engaging. And it's not surprising because these children had a lot of floor time and a lot of warmth, but it is, I think, surprising to the field because of the assumption that children who were given the diagnosis of a spectrum disorder would not have the capacity for intimacy or empathy. You know, somehow the notion that there's a fixed biological deficit in reading social cues or emotional cues or connecting emotionally with people. I hope this begins laying to rest some of those myths that have persisted over many years.